Should we take these figures at face value? Are tragic deaths from COVID actually with COVID or from the disease itself? And how many sad deaths are being wrongly attributed to the virus? To help navigate this complex area and bring some context to the numbers, I'm delighted to welcome Jamie Jenkins, former head of health statistics at the Office for National Statistics, the ONS. Jamie Jenkins, welcome to the show.
Morning, good evening, Mark. You good?
Yeah, very well. Good to have you on the programme, Jamie. When we hear about this COVID death toll, which is well over 130,000 people, what does that actually mean? What is the nature of that death toll? Who are we talking about?
Yeah, so Mark, the figures that you hear every day and kind of come out from the government, those are deaths where there was a positive test from COVID. So they're about 130,000. And we weren't testing many people at the start of the pandemic. So the ONS each week publish a set of statistics which looks at where COVID was mentioned on the death certificate. And that death toll is about 156,000 at the moment. Now, I'll just explain to the viewers how we break these numbers down. So you've got 156,000 COVID deaths where COVID was mentioned on the death certificate. And about 87% of those is where whoever's put the death certificate together has said that COVID was the cause of death. So the other 13% is where there was a kind of another reason for the death, but COVID was mentioned on the death certificate as well. But I've been looking kind of into the numbers because obviously we're trying to learn to live with the virus now. And I've heard that Boris Johnson's thinking about how many levels of deaths we should feel acceptable in the country at the moment. And I suppose what's alarming for me at the moment...
Quoted in the press, Jamie, I think in the Times newspaper, it suggested the Prime Minister could live with, I mean, he wouldn't welcome the news, but he could live with 50,000 deaths a year without imposing restrictions.
Yeah, and I suppose if you look into the figures in a bit more detail, Mark, what you actually find is that we've seen this year so far in 2021 a reduction in the number of dementia and Alzheimer's disease deaths. So they're down about 16%. We've seen a 14% fall in respiratory diseases deaths. We've seen falls from other causes of death as well. And there's no real reason why we would have seen a fall of dementia deaths and Alzheimer's deaths and respiratory disease deaths. We've seen a significant fall in flu and pneumonia deaths. They're down over half of the year so far. But the COVID measures, the kind of all the hygiene measures would have probably brought flu and pneumonia down. But so I think what we're seeing is that the people are always calling out to try and get to zero COVID and zero COVID deaths. Well, some of the deaths that we get told about every day, and at the moment, Mark, at about 100 per day, it's about 90% lower than we had during the peak because of the vaccine rollout. You're never going to get to zero because some of the people who are probably being attributed to COVID deaths sadly would have died anyway because they'd be kind of in the dementia deaths or the respiratory disease deaths as well.
And therefore, how do we get to a better, more accurate picture, Jamie, of what COVID has actually done in terms of the death toll within the country? I mean, do we just compare excess deaths year on year? Is that the best metric?
That is the best metric. And the big point, I suppose, which is emerging at the moment, Mark, and you've been talking about the effect of lockdowns over the last year. And in the last 6 weeks, we've started seeing excess deaths in the UK again. So deaths over the last 6 weeks are about 9.5% above average when you take the figures for England and Wales. But what's kind of striking, Mark, in the data at the moment is that these deaths cannot be explained by COVID. So what we're starting to see now is excess deaths over and above the time of the year, which are non-COVID deaths. Now, if you think of all the deaths that we've had since the start of last March, you would probably expect to see deaths below average because obviously, sadly, people have died and people who may have died this time of year now sadly died early on in the pandemic. So we might now start getting the collateral damage, Mark, where people have missed a lot of GP appointments in the last year. We know the waiting times have gone up. And it could well be now that we've seen thousands of deaths, more than what we're seeing from COVID, from the kind of the measures to restrict people's lives, kicking into the data. And this could be the start now, Mark, of what we might see over the next few years. And you know, who knows, we might see by this time next year a significant number of deaths caused because of the restrictions, not just because of COVID itself.
And when we hear that Britain has one of the highest COVID death tolls in the world, is that something that we need to actually look more carefully at, given the fact that it's compiled in a way that's different to how other countries compile their statistics around COVID?
There is always going to be difficulty in terms of the international comparisons, and there's also difficulty as well, Mark, when you compare. I know a lot of people at the moment are comparing the UK to New Zealand, and you look at New Zealand's policy. Obviously, they're going into these lockdowns. They're trying to use lockdowns to stop the spread of the virus. it's not working. They're continuing to go with the lockdowns. Each country is slightly different as well. The UK can't really be compared to New Zealand, for example, because this is an international hub. Got people coming in and out all of the time. New Zealand's an island, and sadly, we might start seeing kind of New Zealand reaping kind of the bad thing of the Delta variant, where they've kind of kept COVID out of the country, but ultimately it's got in there now and it's starting to grow. So difficulties making those comparisons, Mark. UK hasn't fared
Jamie,
great.
only got a couple of seconds to go, but is there any ballpark figure of what the actual death toll from COVID might be? People that got COVID and were tragically killed by it. Will we ever have that number?
I don't think it's going to be difficult to get the exact number. I'd say it's definitely well over 100,000, Mark, when we know tolling, right? When you take all of the data. Tragically, it's killed a lot of people. I think for the viewers, the main hope now is that kind of with the vaccine rollout and significant antibodies from prior infection as well, deaths are about 90% lower than average.
Well, Jamie, I wish we had longer, but let's continue this conversation again. I hope you'll join us in the studio next time. Fascinating stuff. Jamie Jenkins there from the ONS formerly. More